Welcome back to blackdoctor.org, where wellness and culture connect. I am Dr. Cordai Decoto, board certified podiatrist for Neighborhood Health, a federally qualified health center in New Jersey, providing care for all, regardless of immigration status or insurance. I am also the co-founder of Sisters in Podiatry, a Facebook group that focuses on Black women in podiatry within the United States and the Caribbean, and of course, your host for the premiere show, Stepping Forward with Dr. D, your gateway to all things podiatry. So grab your favorite beverage, get ready for a great conversation. Also, let us know where you're coming from. We want to hear from the West Coast. We want to hear from the Dirty South. We want to hear from the Midwest and, of course, the Northeast and beyond. So let me introduce you to my colleague, and I consider her my friend now, Dr. Kiana Trent. Welcome, Dr. Trent. How are you?
I'm great. Thank you. Thank you for having me.
Of course. Let me tell you about this wonderful physician. She's a board certified podiatrist with an outstanding record of success demonstrated throughout a 13 plus year career serving patients across all podiatric medicine disciplines, including the medical and surgical management, patient care, medical education, and training. She is a podiatric foot and ankle surgeon for the Baltimore Veterans Affairs Maryland healthcare system. All right, B More, we want to see you. And across the Baltimore region, she did her studies at the Ohio College of Podiatric Medicine. We'll forgive you because you know I'm a New Yorker, but we love
Yes.
that.
Yes.
She's a fellow of the American Society of Podiatric Surgeons. She is a podiatrist. She's an owner of De La Soul Podiatric, and I like that name, De La Soul. For
Thank
those
you.
who are into hip hop, De La Soul Podiatric Medical Services, where she's part-time offering a private podiatry practice serving individuals, patients at nursing homes and assisted living facilities, as well as homebound patients. She is the acting chief of podiatry for the Veterans Health Administration. And I'll let her tell you more about that because I think that's amazing. And she's on the executive board member for the board of directors for the American Board of Podiatric Medicine. So without further ado, and the best part that I didn't say is that she is a member of what? The Alpha Kappa
Greatest.
Alpha Sorority Incorporated. So going from the White House to the operating room, AKAs are everywhere. Welcome,
Absolutely.
Kiana. It's great to have you.
Thank you so much. Thank you.
So, Kiana, tell us, Dr. Trent, what got you in first? What made you choose podiatry? And then we'll talk about how you got into the VA.
Okay. So, everyone always asks that question. How did you choose podiatry? I definitely have a lot of family members that had diabetes, and that's what's kind of sparked my interest. While I was a Bonner Scholar at Spelman College, and part of my responsibilities as being a Bonner Scholar was to do community service. So my community service started working with a podiatrist, and that's how I kind of found out about it and kind of fell in love with podiatry. While I was there, my major was biology, so I always knew that I wanted to do medicine. But after shadowing, I got a greater love for podiatry, and I decided this is where I want to be. So that's how I chose podiatry.
Fantastic.
Yes.
Okay. And then now you're big time. Hello. Congratulations.
Thank you so
Into
much.
the VA. So, I love our veterans. Veterans give their time, their lives sometimes, their souls to go over and defend our country. Whatever you vote for, we have to always salute our veterans. So tell me, and I'll tell you, I work for a federally qualified health center. So we serve the insured, the uninsured, the underserved, and beyond. And so I think between the both of us, we are making sure that people are getting care. And a lot of times we see people of color through the VAs and through the federally qualified health centers. So I'm going to ask you some questions. And one of my questions I want to ask is, why did you choose the VA? Because we could go into multidisciplinary groups and work. We can work for hospitals. Many of us join partnerships or even start our own practices solo. What made you say, let me do the VA?
That's a great question. So I will say that most people know somebody that's been in the military. And so the someone for me is my father. it's my grandfather, and it's several of my uncles. So seeing their passion and their commitment to this country, it kind of sparked a fire in me. And I wanted to work for an organization where I felt like I was actually making a difference and that I was impacting the lives of others. So I actually did my residency at the Baltimore VA as well. And I just fell in love with the patient population. There are so many veterans that I met when I'm a resident that, I still see to this day. We see in the hallways and we chat. And it's not just patient doctor relationship. It's more of we're also friends. So
Mhm.
there's something just about like the commitment that the veterans have. And I feel a commitment to give back to them. It gives me like great joy. It gives me great fulfillment when I hear their stories and when I can positively impact their lives. Some things also about working at the VA. It's a multidisciplinary type of clinic. So
Mhm.
basically, when I'm developing a care plan, I have everything at my fingertips. A lot of times in private practice, you have to reach out, to a different doctor, and it takes time to get that information back. I feel like
Right.
VA,
Sometimes we're like,
yeah,
hi, we sent you a note. Can you get back to us?
yeah.
Thank you.
Can you get back to me so I can make my decision? But
Exactly.
everything is there. So it's
Mhm.
wonderful. And I can kind of package everything together in a pretty bow and give that information to the veteran. And lastly, I will say we definitely focus on our core values, and that's integrity, commitment, advocacy, respect, and excellence. So that's what drives me to come to work every day to provide the best care for our veterans.
So, a federally qualified health center, I believe, is an amazing thing to make sure that no one is turned away from healthcare. I believe that healthcare is a basic right. And so, having patients that we have insured patients, we have some of our patients who are underinsured, we
Mhm.
have patients that have no insurance, charity care, and they're coming to seek care for the same ailment that someone else who may have an out, the PPO of the year, as we know, PPOs are great in private practice and beyond to be seen. And I got into that because I wanted to change. I did private practice for a long time. And then I did multidisciplinary group, which I also enjoyed. And I enjoyed the federally qualified health center because I can, just like you in the VA, I can tap on my internal medicine colleague and say, hey, you know what? We have this patient. Let's see what we can do to make this patient better. Let's
Yes.
see what we can do to, why is a treatment maybe not working? Maybe the patient came on referral from somewhere else. How do we come together and collectively make this patient better like a team? So just like you, I get it. I definitely
Yes.
get it. So
Yes.
tell us about, I saw that you have I have a friend, a couple of friends in the military,
Okay.
and I see Dr. Napoor. Hi, Dr. Napoor, who's watching from New York. Welcome. But tell me about what your I don't even know what the initials are. GS0668. I was like,
Oh, that's just that I'm not in the military, so that's just the that was on my CV. So that's just the grade scale for the VA, but
okay. I was
I'm
like,
not actually in the
is there something that the
military.
military wants to tell us? I
No,
was like, I don't know what that means, but congratulations.
thank you.
So as a VA doctor, you don't necessarily have to be a part of the military to be a VA physician, correct?
Correct. That's correct.
Okay. And I'm
Yes.
sure VAs have a variety of doctors who have been in the military and then those who haven't. Do you think it
Mhm.
makes a difference if you have a military background or not?
I think that honestly, I feel like if you just have a heart and a passion for the veterans, I think that's what's going to make you a successful doctor at the VA. I
Mhm.
do believe that if you were in the military, sometimes you might be able to relate to the veterans or the patients a little bit better when it comes down to them telling their history. But I kind of feel like I'm an honorary military service woman because I've been there
How nice of
for
you.
so long. But yes, I feel like, if you have the heart, then you'll definitely make a difference and you'll be a great provider.
I agree. I agree with that. Okay. I would like to ask a second question. So, pathology, because I like to use simple terms. What kind of problems do people come in with? People may think that, coming into a federally qualified health center or a veterans hospital, that we may see things that private practice doesn't see. I beg to differ. So, Dr. Trent, tell us about some of the problems that come into your office. Give us a typical day.
Okay, so this is a funny thing. So they always say it's a common phrase. They say, if you work at a VA, you can work anywhere. And the reason why they say that is because of we have a high volume of patients, number one. We have unique clinical cases that come in, and we do definitely have a lot of pathology. So we have a lot of forefoot pathology, we have a lot of rear foot pathology.
Forefoot meaning?
Forefoot. So the front of the foot, hammer toes here, bunions here,
Mhm.
neuromas. We also have a common plantar fasciitis that comes in all the
The
time.
heel pain, folks.
Heel pain, sorry, heel pain, as well as flat feet. So that comes in a lot. We definitely do have a lot of diabetic patients that come in with problems. And those problems include bone infection or osteomyelitis and gangrene. So those are some of the things that we treat on a daily basis. But let me give you a rundown. You asked for a rundown of
Yes,
our
give us
day.
a
So we have a residency program. So we come in, we round on the patients that are inpatients in the morning. We get ready for the day. We review the clinic list. Usually I have a clinic, the residents have a clinic, and I see my patients. They also see their patients and present to me. Some days we have journal clubs. Some days we have review of cases. And there's also a wound care. It's Wound Wednesday. So we go over a lot of the patients that are difficult to treat. And then at the end of the day, we kind of print the list, get ready for the next day. And sometimes we have add-on cases, and that does happen a lot. So add-on cases are basically emergent cases that may have come through the emergency room that need to be taken to the operating room that day.
Typical day for the federally qualified health centers.
Yeah.
So we usually have a huddle. It's all our medical assistants, all practitioners, and we come together in the morning and review our list of patients. We know who the diabetics are, if they're controlled or not controlled. If there's somebody with hypertension that has an issue, what have you. Oh, we got somebody saying hello. We've seen Shuma Pemberton from the DMV area, just like you. We're saying woo woo, hello. So we huddle and we know what to expect for our day. And we have just like any computer or electronic health records, we can see everybody's background and what they come in for if they're new. And basically, just like in private practice, we're running from beginning, coming in, hello, how are you? And making sure we're seeing fractures, we're seeing diabetic foot care, we're seeing neuromas, which is nerve pain. We're seeing a lot of neuropathy. We're seeing some fractures. Seeing tendonitis. Anything and everything. I believe that the VA and the federally qualified health centers probably are seeing some interesting cases that might not make it to always to private practice. So that gives us a little bit more girth and birth of some of the things that we see. And that's always exciting. So I feel like, short and residents, I do work with residents when I'm doing cases in the hospital. Don't round with them anymore, but I do that. So I get it. I get it.
Yes, yes. And it's always a pleasure to work with the residents because you
They're
can see their
fun.
growth.
They're
Yeah.
fun.
So
And
they're
it keeps
starting
you
from
on your
first
toes,
year.
right? You can't work with a
Absolutely.
resident, then you may not, teaching ain't for you. And also it makes you on your toes. I personally like asking our residents sometimes, which is good for anybody, like, hey, what did you like about the case? What didn't you like about the case? And do you think anything you would change about the case? And I think that pushes them and us being attendings to be stronger and empathetic and, more talented in what we do.
Yes.
So yes to our residents.
Yes.
So question number 3, and then we're going to chat some more. Talk about surgery. Some people think that if you're, I guess they think that, only private practices or these big mega groups or individual doctors would do surgical procedures. Tell us, do you do surgery? And B, what does that look like through a VA hospital?
Okay. So definitely, I do surgery. We have a heavy surgical volume at the VA. And I will say that cases or surgeries go pretty much every day. So we have a scheduled day, and that's Thursdays, and that's usually for our elective cases, and that addresses some of the pathology that we discussed before. And then we have days where there's urgent and emergent cases, and those cases are mostly diabetic. So diabetics that have wounds or diabetic foot ulcers, ulcers on their legs, which are like venous ulcers, as well as bone infections or osteomyelitis. So at the VA, there is a program that's called the PAVE program. And PAVE stands for Prevention of Amputation in Veterans Everywhere. So we are actually required to see veterans that are high risk. So meaning they have diabetes and they have neuropathy or peripheral vascular disease, and kind of rate them and give them a score. So those veterans I see often. And unfortunately, some of those same veterans are the ones that need surgeries. And that's really my kind of niche where I focus on a lot of the amputation prevention and wound care. So a lot of my surgeries are amputations and debridements and
What's a debridement? That's a big word.
debridement. And so I'm basically cleaning up dead tissue. We call it necrotic tissue, but I'm cleaning up that wound to make it a healthy granular, which is a nice beefy red base so that the area can heal. So I do a lot of that. And stop me if I'm rambling, but I get
Not
really
at all.
excited and passionate when I talk about this because it's like a puzzle piece to me. So basically, a case is presented to me, and my goal is okay, do I need to debride or clean up the wound? Do I need to amputate? How much do I need to amputate? And how am I going to get this patient back to their baseline of having, their normal life?
Mhm.
And it doesn't really stop there because after the surgery, you need to address why did we get here? So for me, it's focusing on, do you have an endocrinologist or someone to check your diabetes? Do you have a nutritionist who's someone who's telling you what to eat so that we can prevent this problem in the future? So we're definitely surgery packed. We all have special areas that we like to focus on, and mine's definitely wound care.
Fantastic. So federally qualified health centers, if I think that I probably have a little bit more limitations. If the patient has insurance, not a problem.
Mhm.
I do surgery. One of the recent cases I did was lapoplasty, which will be on my October show. Then the new 3D bunionectomies that are hot, and I'm certified to do it.
Yes.
What happens, I think, in the federally qualified health center world is if you have insurance or like any other patient, you come in. I think my niche is I like cosmetics. I'm published for my cosmetic incisions. I like bunion and hammer toes. I also like diabetic care because I think that especially saving someone whose foot, can I save this, and working with a good vascular doctor so that instead of maybe cutting off your whole foot or your leg, maybe I can cut off a toe, or maybe I cut off a portion of your foot and not keep you still ambulatory, be able to walk. That's big for podiatrists, to keep you moving and grooving as best as we can. I like when diabetics, I try to keep them on point. Like, you know what, incorporate me into the family. Okay, I'm your niece, your cousin, because we're
Yeah,
going to be married together.
exactly,
To
for
make sure
life.
I see you, make sure, so those are big deals to me. Where uninsured patients, that is, I think where we have our limitations, because basically charity care will treat you in the facility that you're in, which is not surgery, obviously. If
Mhm.
they have to have a surgery, obviously non-elective things, then they have to go through the hospital, through the ER, and get what's called emergency charity care. And that means that the podiatrist who has privileges, I shouldn't say privileges, who's hired by the hospitals, the hospitalist podiatrist is the person who does the case. So sometimes I will get those patients, they'll be sent back to me, obviously. But those cases, unfortunately, because they have no insurance, I can't go to the hospital and just say, hey, I'm taking the case. That's from the hospitalist. And I think that's one of the hardest things, unfortunately, for me to see. But for insured patients, yes, just like you, I want to make sure that you're walking pain-free. I like to try all conservative care, as I'm sure you do too, Dr. Trent. But
Yes.
there's when we get to that point, particularly in our wound care patients, like, listen, it's not going to go your way. You know, we just had a patient the other day who did not. I told him the toe. He had a second toe. I'm going to say it for everybody here, that blew up twice the size of his other toes, and it turned dark. And he's African American. I was like, okay, but that's dark, dark. And I
Mhm.
knew he had a bone infection. He's diabetic. I knew. And I said to him, this is not an office case. You need antibiotics through an IV. And he was like, I got to work. And we understand that people's lives dictate sometimes their care. But I said, sir, with everything in me, if you were my uncle, I'm telling you, you need to go to the hospital. Of course, he went to the hospital. He listened. And he ended up having an infection, of course, osteomyelitis. We looked on x-ray. Then he did an MRI to follow up to make sure it didn't spread. He only lost his second toe. So this toe, thank God, because he listened to me. And he
Right.
called and was like, Doc, you were right. And then I called him back to give him some kind words to encourage him. And then I saw him the other day and he was like, thank you, thank you. And we don't want anybody to lose anything, but that's why we're here. So making sure that people have access, I think, is the biggest thing for what we do. So let's talk about access for a minute. So veterans, let's talk about that. I believe that if a veteran should have the medical care for any and everything. If you've been fighting for me, I'm here for you. What does that look like? Let's talk about a veteran that comes in and they need to see they're having bad foot pain. Let's just say they have heel pain. What happens when that veteran tries to see you? Walk us through that process.
So usually, if it's a new patient, a veteran comes in and their complaint is presented to their primary care physician, and so that primary care physician will then put in a consult to podiatry, and that consult is then reviewed and scheduled with the podiatry clinic, and then they're able to see us. So we all know that sometimes it takes a while to be seen. So they have new metrics in place, which is working great. That for specialty clinics, I believe it's 28 days. If we can't
Mhm.
get the veteran in within 28 days, then we do offer them care in the community. And care in the community is the ability to be seen by providers that are contracted with, or I shouldn't say contract, but they are they are approved for veterans to go to in the
Mhm.
community to get them the care that they need in a timely manner. So sometimes there's other things that play a role in them being seen on the outside, and that's like drive time if they're too far away, and I believe it's more than 60 miles, or if they don't have like a fully functioning VA, they're allowed to be seen on the outside. But we definitely encourage all veterans to stay in house because, like we discussed before, all your records are there. We can create a care plan for you, and we're definitely there to serve you. And I agree with you that if the patient needs to be seen and it's a veteran, we need to do everything possible to get them in as fast as possible.
For the federally qualified health world, patients make an appointment. They're usually seen by their primary care doctor. If their primary care doctor is with us, then their primary care doctor will refer them. Insurance is sometimes dictates if they need a referral or if they don't. Some insurances don't, and they can make a direct deferral. I also get patients from the outside, so I have primary care physicians refer to me, or patients who don't need a referral who have heard about me word of mouth when they come to see me. My turnover for an appointment, I think, is probably 72 hours. I'll say 3 days. Usually you can get an appointment to see me. And then I accept walk-ins for emergencies. Sometimes, as you know, we might have a patient who comes in who's, oh my God, I just fell down the stairs and my ankle just blew up.
Yes.
Oh my gosh, I stepped on a nail. Take a look at this. We don't want, especially with somebody with poor circulation or diabetes, we definitely don't want them to wait and have an infection fester. Um, I believe that getting to get access is the biggest thing that for patients, as we're talking about, again, veterans, the underserved and uninsured, it's access.
It's actually.
And for a veteran, because VA hospitals, I mean, we have them everywhere. I would hope that access would be something that they get when they need it and not have to be delayed for any reason, needlessly.
Absolutely.
Right?
There's another thing that the VA is doing, and it's secure messaging, which is just a messaging platform where veterans can basically reach out to their providers directly. They sign up through My Healthy Vet. They can visualize their records, and if they do have a question, they reach out to their providers directly and usually get a response within 48 hours. So that's definitely an improvement.
That's definitely an improvement. Guys, say hi. Tell us where you're from. Say hello. We love that people are logging on. Welcome, welcome, welcome. Yeah, we have that. We have something called Call My Doc. And so, checking messages and things of that nature. So definitely, we're not always perfect at it, but we definitely try to get back to you as soon as we can. So tell me why, I guess my next question, I have a few. Why I'm going to, for podiatry particularly, why would I, if I'm a vet, why would I see Dr. Trent in a VA hospital versus Dr. Smith in private practice? What makes you appealing to the vet to be seen?
So definitely, I would say once again that plan that I have everything there. I'm going to collaborate with the providers. I can reach out to them basically while you're sitting in the office and figure out what's going on with you and provide you the best treatment plan. Also, I think that providers that are at the VA have a just a commitment to that veteran. I'm not saying that providers on the outside do not, but I feel like if you're at the VA, then you definitely have a passion for that population, and I think that you probably will get more compassionate care from a VA provider or from myself, actually.
So I have someone who's a veteran who says, how about consults? As a veteran, I experienced a 6-month wait to just get an appointment for podiatry. What do you say to that?
So I will say that some of the facilities, we do need more providers. So I'm not sure what happened with the consult. However, if you did not get in within 28 days, you should have been offered the opportunity or the option to go on the outside, and not have to wait the 6 months. Always, if you have an issue with getting an appointment or anything else, you can always contact patient advocate, and they will kind of guide you in the right direction. So we never like to hear stories like that, and we're always looking to improve.
Okay. Hopefully that's answered her question. We see Dr. Stacia Jones, who logged on saying hello from Virginia. Um, one of the other questions we got is, this is another veteran who said when she was seen in podiatry, she said that the provider spent a total of 10 minutes. And then I'm going to answer some questions on the Federally Qualified Health Center front. And she felt very rushed. What would you say to that?
So I do apologize that you had that experience. So definitely do not like to hear of things like that. Um, we did discuss having a high patient load. However, that's no excuse for not providing the time with the veterans. So I always tell veterans to advocate for yourself. So if you feel like you're being rushed, once again, you can reach out to that provider directly through My Healthy Vet and speak to them. You can discuss it with patient advocate and just express your concerns. A lot of times the providers are very busy and rushed, but if you talk to them and say, look, I feel like you're kind of rushing through this information. I don't understand what's going on. They should definitely take the time to explain it more, and maybe on the next visit, afford the opportunity to improve and provide you with better care.
So one of the things I'll say from the Federally Qualified Health Center front is time. I think we get a little bit more time. We're not sometimes as busy as private practice. So at least I'll speak for myself. And so I can spend time. I think time, new patients, you're getting to know them, questions, literature that you can give. I have literature in English and in Spanish because we have a large Latino population where I practice in Elizabeth and in Plainfield in New Jersey. And I'm bilingual, so I speak Spanish. So I can go into either language and chit chat with you and try to explain it to the best of my ability. If I'm struggling, particularly if it's in Spanish and I feel like maybe you're not getting it, our medical assistants also are bilingual, so I'll bring them in there for more clarity, because my biggest thing is, did you understand? If you don't understand, then you didn't have a visit, because what's the point? You can't intelligently make a decision on anything. So that is a big thing for me. And again, as you're saying, to getting these appointments, I try with walk-ins. I try. If it's crazy, I'll be like, listen, let me hear what it's about first to make the decision. That's called triaging, just like in a hospital when you go and they take the more sick patients versus the less sick patients, depending on what part of the ER you're in. But I do think that we all should take time. That's one of the things I constantly hear from my friends who are not in the medical fields. They feel rushed. And, unfortunately in medicine, I guess we can have that conversation right now. We're on this, let's blame some insurance companies where they are making us see follow-up patients every 15 minutes and new patients 30 minutes. Sometimes, depending on specialties, it might be 45 minutes to 60 minutes, like oncology. So some of those things also dictate to us how long we're in a room, how to answer your questions, the wait. Some doctors will take more time, and then you have patients outside who are like, I've been here, da da da. But again, if your problem is complicated, if I'm going to do an amputation on you, I need you to understand everything. And I tell patients, even for elective surgery, I give them literature. I'm like, go watch a video or go look it up. And I draw on them. My patients are like, you don't draw on me. I draw. So you know exactly where your incisions are, particularly in patients of color who may scar more aggressively than our lighter skinned sisters and brothers. I want you to realize that if you saw a certain incision on somebody who may be Caucasian, that may not look the same on you. Mm-hmm. So I think that time becomes, time is valuable on both ends, because we have to be, sensitive to our patients, and also, being sensitive to the higher ups. And until we figure something better out with insurance companies, I think it's unfortunately always a problem. What do you think, Dr. Trent?
It's true. And I will say one of the things that I often do is I definitely will follow up, and I'll give my email address. So sometimes if I know I've talked a lot and I've given them a lot of information, I'm like, this is just too much. I'm sure they're going to have questions. So I'll either provide my email address, and they can, email me and I can explain it a little bit more. Or sometimes I will send them additional information about the topic or the pathology that I just saw them for. So that definitely helps. And it helps to improve the rapport between the veteran and the provider when they feel like, you care.
Do you think there's anything, and I can definitely answer this question, do you think there's certain care that the VA cannot provide versus private practice?
Are we talking podiatry specific or just kind of in
Podiatry
general?
specific. We'll stick to that.
So I will say that I definitely think that it varies based on the VISN that you're in and based on your facility. But I think off the top of my head, there is some care that the VA doesn't provide, and I think that's laser therapy. I
Mhm,
think that on the outside, a lot of that is cash pay
mhm.
if you're going to do laser. But that's one of the things that I know the VA, what I should say, I believe the VA doesn't provide. What about with you?
I definitely know laser because we have a lot of uninsured patients, underinsured patients, so that's not happening.
Hmm.
We do ABIs. So for those who are like AB who, ABIs, we do vascular testing, which is a basic vascular test. Besides me feeling for your pulses on your feet, which every podiatrist should be doing to make sure you have good blood flow. Well, if we don't feel them, we do a test, and it's like 5 minutes. It's fun, nothing invasive, to make sure that we have blood going into your feet. If not, automatically you're being sent to one of our vascular colleagues for your circulation to figure out what they need to do. Further testing like an MRA, further testing, which can be anything, and then procedures like stent placements or bypasses or what have you. Because if we can nip something in the bud early and you injure yourself, we know blood will flow there. When blood doesn't flow there, then we're starting to talk about gangrene and amputations and things of that nature. I would say I would say laser. I would definitely say Cariflex, which I know I've mentioned before, which is an FDA approved topical that goes over nails. So those little fake nails that y'all do at the nail salon, you can get infections badly. This is something that some private practice doctors do, and it's fabulous. So some of the more cosmetic um, options, and obviously, unfortunately, for patients that don't have insurance, are DME. DME, let's talk about that, durable medical equipment. So you come in, woo, your foot hurt. You're like, oh my God, you have heel pain. We'll inject you, what have you. We don't do x-rays in our facility. We send patients out. We usually use a facility so that we're linked to them and it automatically appears in our computer. But if you need something like inserts or orthotics, if you need a night splint, unfortunately for our uninsured patients, it's just not covered. That's through a separate company. They do make allowances in terms of reduced pricing, which I'm pleased with, the company that we use, so that, and payment plan for patients who really want it. So those are things to think about. But in terms of, and especially with veterans coming back, I mean, you've been running, fighting for our country. Your feet must hurt. So tell me about what your durable medical equipment looks like for your patients.
So our process is a little bit easier with that. So everything goes through prosthetics. So everything at the VA is a consult, consult, consult. But
Mhm.
luckily, prosthetics for us is right below us. So a lot of times I'll see the patient, I'll tell them what their diagnosis is, and I'm like, look, we can get you walking, we can get you feeling better right away. I'm going to put this consult in, go right downstairs. It's so funny. Sometimes I'm like, run downstairs, and they're like, Doc,
I
I
can't run.
can't
How you
run.
gonna tell somebody to run downstairs? That's
Yes,
a trend.
exactly.
I want
I know.
everybody to give her the side eye right now. Like,
I know. I don't say it anymore. I'm like, okay, go downstairs. You'll get your inserts or, get measured for your shoes or your compression stockings or whatever you may need. So ours goes through a prosthetics consult. If there's a device that we think that the veteran will benefit from that I know it's not downstairs, then basically it has to be ordered. But we don't usually have a problem with getting in durable medical equipment or any supplies through prosthetics.
fantastic. Say we have another. We see you, Rosalind Chapman, saying hi from where? Brooklyn,
Brooklyn.
BK. We see you. Thank you so much for tuning in. So let's talk about veterans a little bit more. So, what if you have a veteran that has PTSD? Maybe they don't want to be touched. Maybe, and, there's a lot of, we have patients who come in our practice sometimes who have crossed the border and sometimes have had trauma with that. How, what do you do with patients like that? Besides being a caring doctor, we can see you clearly
Mm.
are. Walk us through that. How does that look like? Because we want our veterans to feel like, going to the VA is a safe place. And if they have, problems if they're below their knee, they can come and see Dr. Trent and other podiatrists in the VA if they so choose, and that they're going to get great care and compassionate care. So tell us about that.
So I would say, like, I guess a lot of times, if it, and it doesn't happen often, but I know a lot of veterans do suffer with PTSD. But if they come in and they're in that state where they feel like they don't want to be touched, or something has triggered them, then you know what? I change the focus. So they tell me what's going on with their foot, but at this point, they're not even wanting to talk about that. So I take the time to listen and see, what's really going on with you. Do I need to place a mental health consult? I definitely reach out to the primary care after in the note, tell them what's happened, and ask that they reach out to them, because they know that veteran more intimately, and they can definitely follow up with that veteran and get them on the right track. Once again, I'm always giving out my email, always giving out my card. So I say, call me when you're in a better place. And I'm not going to make you wait for an appointment. You already came for your appointment. Unfortunately, you were having a bad day. I'll call you back. We'll email back and we can talk about your problem that way. So that's usually how I deal with it. But I definitely want someone who is more qualified to treat mental health to be tagged on the note so they can reach out to them, because we definitely don't want any crisis to occur.
I don't want you getting mad at me. I have patients who will come in and have, anything from a bad day to, some mental health issues. We also have paired up with something called Bridgeway that for mental health. And I appreciate that, where if I notice something, I can punt it to the appropriate colleague to get involved. I mean, and again, I would never, my thing is, if you don't want to be touched, you want to be touched. Let's talk about it first. Maybe it's traumatic. Maybe you have an infection and you're terrified that I'm going to tell you this toe has to come off. Maybe, soul food. Anybody who's watched Soul Food, when Big Mama had to, I love the references. When Big Mama had to have an amputation, it just doesn't affect the actual patient. It also affects their family and their loved ones. So sometimes a conversation of just like, hey, this is what's going on. Let's talk about it, and we talk. And then I'd be like, can I look at it? Do we take off your shoes? Sure. And you go in stages so that no one feels, that their civil liberties are being disrespected or feeling uncomfortable. Because I don't want to feel uncomfortable. I don't want you to feel uncomfortable. I want you to be like, okay, this doc gets me. And, I share stories sometimes too. And, a lot of times my patients, I had a patient today, not a mental health issue, but I walked in a room. I was like, hi, how you doing? Are you all right? Mm-hmm.
Like, what I do?
My mama. I was like, okay, let's try this again. Hi, how are you doing? I know her. She's like, mm-hmm. And I was like, we feel better. Mm-hmm. I said, well, you know what? My foot feels great. And I did a little dance. And she looked at me. She wanted to laugh, but she didn't want to because she was bad. I said, so tell me, you're still in pain, right? Yes. Patient has heel pain. Patient has had injection. Patient has had physical therapy. Patient has inserts, not working. So I said, yes, we're going to do an MRI. And she looked at me. She's like, you're going to do an MRI. Thank God. I said, did you think that I would not do that? She's like, well, I know some doctors don't like to jump to that. And I thought you were going to make me do something else. I said, I'm always listening to my patients. I said, we're going to do an MRI. Okay, baby. And then the conversation. And sometimes it's just a matter of connecting with your patient,
Absolutely.
and letting them know, like, I'm listening to you and I'm going to fight. I fight insurances sometimes where I'm just like, but I'm going to fight
reviews and all.
Exactly. Like patients don't know, when you guys get things rejected, we're fighting for you. Sometimes we're like, we're going to be on the phone for an hour trying to do a peer review to tell the insurance company why this is necessary.
Why this is needed. Yes.
And sometimes they have to hear your story, from us for them to go, I get it.
Okay. Yes. And I will say at the VA, it's a plus because we really don't have to jump through those hoops. Usually it's like, this patient needs this and I'm ordering it. So, you might get pushback sometime, but for the most part, if you need it, we're going to fight for you to get it.
Well, I love it. I wish I could do that. I was come to me, but it doesn't always happen. I see Sheree Love Lucas. Hi, from Clarksville, Tennessee. I love, let me tell you, went to Memphis and it was not Clarksville, but I had barbecue and I loved it. So welcome, welcome, welcome. We love that you're tuning into us. So what I want to ask you, tell me, one of my last questions, and I'm going to ask you a couple others, is people of color. So this is black.org for everyone, but of course we represent the Black community. Do you think that Black patients, veterans, are being treated any differently? Sometimes we are in a world where we know that racism exists, unfortunately. And how do you feel that sometimes our Black vets are treated? And when you see them, what is a rapport that you have with them?
So I'll start off with, I guess, my rapport with them. So, of course, when you're seeing patients, you're treating everyone with respect, with everyone with dignity. But I do stress to people of color, because I've noticed, and not all people of color, but I have noticed that sometimes they do shy away from the doctor, and they shy away because they're afraid of the unknown. So I definitely advocate for them, and I tell them, look, you need to be on top of this, because if not you, then who's going to be on top of this? So you know your body best. If something's going on, you need to come in here. You know, in addition to coming in when there's a problem, you need to practice preventative medicine. So you need to be listening to your primary care physician and doing the things that they tell you to do, so that you don't always have to get to the specialist. So that's what I do with the people of color. I will say that I have not personally seen people of color being treated differently. I know that it may happen, but I have not seen that. And for me, if I did see it, whether it was happening to an African American, whether it was happening to a Caucasian, you have to speak up, because everyone deserves to be treated fairly and with respect.
So yes, and sometimes I think that, I've heard it. Have I seen it? Unfortunately, yes. Not necessarily in my group, but
Mhm.
I've seen it. I've heard the stories.
Yeah.
Unfortunately, from across the country, it happens. One thing I think is I look like you. So, and that doesn't always guarantee that if I look like you, you get the best care, because I have other colleagues who don't look like you who give an amazing care. But I do think that if I'm looking like your cousin, your sister, your mom, Dr. Weil had mentioned that about people who look like you
Yeah.
usually respond better to you.
Mhm.
So, sometimes I've gotten from people of color, how old are you? And I'm like, thank you. Thank
Oh,
you.
yes, yes.
Appreciate that, right? We've gotten that. Baby, you the doctor? And somebody told me they had clothes older than me, which I laughed. And I was like, okay. I think that was more when I was in my 30s. My 40s, I'm still getting it. So I appreciate it, but probably more so in my 30s. So
Definitely
I
appreciate
think that, to me, that's not an insult. That's a compliment. I've had patients look at me, flirt with me. I've had patients say, you look like my cousin. Let me show you a picture. And I love that, because I feel like it makes you more personable.
Yes.
I feel it makes you, I'm a doctor. I have to go to a doctor too. We're still humans, both of us. We have our own doctors,
Mhm.
and we want to feel that same care. Um, I like that when my patients can laugh, we leave on a laugh or a smile. I see peds, and we'll talk about that as
Okay.
well. So I see peds, and a lot of times I always tease my pediatric colleagues. I say, they go crying to you. They come to me like, or they start crying. So what I usually make my pediatric patients do, because parents are looking at us like, okay, what's going to happen? I say,
Mhm.
you can walk down the hallway. They look like, okay. And if they want, I'm like, walk with mommy. They're like, this is cool. And
Okay.
then they're like, okay, you can run down the hallway. I've had peds patients look at me like, there's no way I'm doing that. Let me look at my mom
Let
first. Like,
let me make sure it's
for
okay.
real, for real. And it makes me laugh. And then the trust is established. So
Yes.
when we're evaluating them, I might let them draw on me so I can draw on them. And they look at me like,
Okay.
and then I
Yeah.
get my doctor. They're happy. I didn't poke them. I didn't stick them, with the
Mhm.
exception of obviously like an ingrown nail procedure or something that they're already in pain for. But
Yeah.
that is another thing. It's making people feel comfortable and
Mhm.
wanted. And
That's
somebody asked how
amazing.
old I am. I'm gonna be like, old enough, in my 40s.
40s,
But
yes.
yeah, we get that. I think female practitioners a lot more so, and definitely women of color get. How old are you? You're
Mm.
really the doctor? And I'm like, oh, they're welcome. I'm running this. Thank you. Um, we're here, Sisters in Podiatry. There's at least 100, and I think we're at 189 members across the US and practicing in the Caribbean. So there are Black podiatrists that are in your neighborhood that you can find if you so choose.
Yes.
So let's switch topics for a minute. So why, this is for people who are interested in podiatry or residents. Why
Mhm.
would I do a residency at the VA? And I know friends who did it, and I want to hear. So, you have a podiatry student, and they're like, I'm trying to apply. Why should they not do a big mega hospital and go for the VA? What are the benefits?
So, all VA residencies are different. However, I'm going to talk about our VA residency, which I
Name
believe
your
is
hospital, name your residency again for everybody.
so we are the Baltimore VA Podiatry Residency, which I feel is one of the greatest residencies out there. So you do a wide variety of rotations. Everything is not just done at the VA. You
Mhm.
do work at the VA, and you see a lot of pathology here, but you rotate next door, the University of Maryland. All VAs are usually associated with a teaching hospital. So you
Mhm.
rotate at University of Maryland. We also rotate at Sinai Hospital, where you go to Rubin Institute, where you see some of the most amazing procedures. You do peds at that location. You do a lot of frames and rear foot. And for people who don't know,
Okay.
that's
You
like
said big word. What is a frame?
frames. So it's we call it an external fixator, and basically it looks like a big ring of metal that is placed around your foot or your ankle to shift things and stabilize things. So that's a big procedure. So Sinai, and they will also rotate at the DCVA. I will say that our residency director loves the residents. So everything she does, she pours her heart and soul into the residents. So that's another perk and a plus of our program. Let's see what else. We do a lot of labs. So labs are important so you can get hands-on skills before working with patients. And we do Wound Wednesdays where we evaluate patients and their wounds. Also Journal Club. So it's a busy 3 years. And the thing is, I always tell people the smartest you're going to be is when you're in residency because you're constantly learning. You are constantly being challenged. Once you graduate from residency and life hits you and you get married and you have a baby, you don't have the time to sit down and just read and learn. So um, that's a big plug for our residency, Baltimore, VA.
Baltimore, VA. All right. So I in my residency, I did my residency at St. Barnabas in the Boogie Down Bronx, New
Okay.
York. And yes, so we saw a lot of pathology just because of location. New
Yeah.
York, we say if it didn't happen there, it didn't happen anywhere. So
Mhm.
same thing, rotated for pediatrics, radiology, general surgery, internal medicine,
Yes.
pathology, everything. Do you think that do you think the training's any different for someone who did VA training versus, say, regular quote unquote hospital training? Is there anything that you think that the VA gives residents more so based on your experience?
You know what I would say? I think that the VA might give them an opportunity to try more, I guess, devices and more products. Because at the VA, we have so many reps that come in with different devices, and you can try them all. Sometimes, like
Mhm.
in private practice or at other hospitals, there's a cap on what can be used. Pretty much at the VA, if you can advocate for why a certain product can be used, you'll be able to use that product. So I think that you get a lot of exposure to more products, more surgically, and more advanced wound care products. And for those that don't know, those are kind of like grafts or materials that we use to place on wounds to help heal wounds.
Okay, so tell us, I mean, especially as you are now working with residents, what does that look like? Like here comes Dr. Trent, and Dr. Trent is, a woman, and it's fantastic. And now you have these residents eager under you, like, yes, Dr. Trent, walk us through what that looks like. Give us a day of what you put your residents through.
So we're always telling the residents that you need to be one step ahead of us. So basically, that looks like when I come in, I expect the list to be run for the day. So I expect you to have printed off a list and know who we're going to see. Actually, I expect you to do that the day before and kind of work up a plan so that when the patient comes in, we're not spending all the time talking back and forth about what are we going to do. We kind of have a goal, and this is our plan for the day. I expect you to have pre-rounded, so you've at least looked up the information on the patients that are inpatient, and those that inpatient means patients that are admitted to the hospital for a problem. So look up what's going on so that when we go and see them together, we can have an educated conversation with the patient and we can move on to the next patient and start our day.
Mhm.
Um, just basically being prepared. So if we're in a room and we're working together, if you know it's a wound care patient and you saw what we used the last time, we don't anticipate any changes. Having everything available, having the supplies that are needed, having the dressings that are needed, having knowing that we're going to need to put a consult in for prosthetics to offload for like a special shoe, things like that. So that's kind of like what we expect from the residents. And you said you work with residents too,
I
right?
do. So I work but it's not so much rounding on patients. I work with patient for surgery. So my thing is don't come in my OR not knowing who the patient is.
Right.
Make sure you ask for the x-rays, prior because we want them to be prepared. Make sure you understand that most teaching hospitals, institutions, there's residents. And we're big about that. You're not touching my patient in any form or fashion unless I know what you're capable of. If you can't answer my questions and you don't know what to do, you should be able to. And I love when students come in because I make the residents explain to the students. And if you can't, you know you don't get it.
Then
because if I can talk to you, I can say, make a 3-centimeter incision, slightly lateral. That's great now. But if I can tell you when you're at that bone, you should hear a click. And that makes them realize it. I'm very audio visual with my residents, in addition to reading, obviously, textbook information. I like my residents to be kind to my patients. Don't come with the big words because they didn't go to podiatry school. You did. So if your consent is bunionectomy up the third lateral rip, we're going to try that again. Now it's computerized because you didn't explain to the patient. Patient didn't explain. My consent's 4 pages and it has pictures and the whole 9. Your consent better be on point for the hospital. So my biggest thing is, and if my patient doesn't feel comfortable with the resident, then you can't do the case. I'm sorry, but it's not just teaching. It's about the patient's comfort. And most of my experience, usually they love the residents. And sometimes when I was in private practice, my residents will come and visit and see the patient and they loved it. Like, okay, let's tell you how I'm feeling today, And I think that's such a great relationship to have because the residents learn that real life is like. But these are people with real lives, children, taking care of other people, working. And this is not just textbook. This is real life. And how do we deal with it? So I'm big about that. We always see our patient family after. If I can't, because maybe we make cases back to back, the resident's required to go and come out and say, your family member's doing great. This is what we did. We'll even give them the x-ray to look at, which a lot of my patients' families like ooh, and we'll explain it to them. And so it's about feeling good, and checking, obviously, when they recover in the operating room, in the recovery room. How are you? I know when I wake up anesthesia, I'm crazy. I'm there. I'm like tangled up and stuff. And I'm all over. I'm a mess. I feel for my surgeons and sorry guys in the past, but I always come and when they're fully awake, I'm like, okay, how you doing? Checking to make sure they're good because I'm trying not to get any phone calls. If you're good, then I know I can go to sleep and not have to worry about that. Hey, doc, I don't feel so well.
Yeah.
That's really big for me.
You know what it is? I don't think they know that we worry so much about them, So
it's like having like family. We're concerned. We don't want you to, all right, see you later. It doesn't work like that. We want to know that you guys are pain free. There's no issues until you come and see us for your post-operative care.
And one of the things that we try to improve upon is, the residents, they rotate so often, but they like to see follow-up. So like the resident may do a surgery and then maybe 2 weeks from now, they're on a new rotation and, they're come in and they're like, how's Mr. So-and-so doing? So that's one of the things that we're trying to improve upon, even if they have rotated to another rotation, and we try to kind of present what happened because they love to hear, they've helped with the case. So they want to know the outcome.
Exactly. And they should, that's part of learning. It's not like, okay, bye-bye. That's not real life.
Exactly.
You're married to your patients, for a while and, family comes in sometimes with them. So you get to know everybody and you want to make sure your patients are good. I usually give my cell phone number for my surgical patients. And I tell them that my after hours time is 6 to 10. Otherwise, you get a message telling you to contact the hospital. The residents will take care of you, and then they'll call you if it's an emergency. But my patients are respectful. There usually has not been a problem. If they do, they're good about stuff like that. So appreciate y'all for those who are watching that. Because we got lives too. We're tired. But we're here for you. Is there any other, as we talked about federally qualified health centers in our surgeries, what do you think? I like the FQHC world because it gives me an opportunity. My federally qualified health center, Neighborhood Health, we do a lot for the community. So we have a health fair coming up Saturday. And so it's nice when you can go outside, dress down and, hey, they see you outside the office and make sure everybody's good. I love speaking on various things. As you know, I am on the regional medical team for Alpha Kappa Alpha Sorority Incorporated. And we have Sisters in Podiatry, which myself and Dr. Kimberly Bowdry Thurmond created. So what do you do outside of the VA in terms of educating folks on podiatry?
So let me back up just a little bit in the VA. So we have, there's a walk that's done at the VA and it's for homeless veterans. So last year, it was organized by a different department, but I just took on the role of organizing it for the surgical department. So basically it's a walk, donations were accepted for homeless veterans. So that's one of the things that we do, at the VA. There's plenty of programs, but when I heard about that, I was like, oh, I have to get involved in that. But outside of the VA for podiatry, I do a lot of health fairs. Um, I do a lot of presentations. So I'm in Jack and Jill. So if they wanted a presentation, and Jack and Jill is an organization for young kids, African American kids. So I'll do presentations there. I'm involved on the board, the American Board of Podiatric Medicine. So we do a lot of engagements where we're talking about podiatry. So, at the end of the day, outside of podiatry, I just like to spend time with my family and spend time with my friends, but that time is limited. I'll say that. And I have a 2-year-old going on 3. She'll be 3 next week. So she's keeping me
Yay,
busy.
happy birthday.
Thank you, she says.
Yeah, for the federally qualified health centers, we also have a food bank, which I've helped at. I really like that. We
Yeah.
have clothing drives. So we make sure besides giving health is comprehensive, having somewhere to live, having clothing, having, we have food, scarcities in this country. So making sure that we have that. And we see you Eastern Piedmont watching from South Carolina, Jack and Jill as well. So we say thank you for that. So we're going to wrap up. I want you to tell us, Dr. Kiana Trent, you've been a pleasure.
Oh, thank
You're
you.
my sorority sister. We love
Yes.
that. Where
first
can we
one to
find
find
you? Where can we find you if we want to see you as a patient? And where can we find you on social media?
Okay, so like I said, I'm at the Baltimore VA, so I'll just give out my email address. It's Kiana, it's KIANA, period, Trent, TRENT, @va.gov. And my social media is Dr. Kiana Renee, and that's on Instagram.
All right, so you can find her. You can be like, I saw her, I know her. You can always find me. I'm at Talks with Dr. D. Talks with Dr. D is the umbrella for the 3 pillars of my organization. So we have Stepping Forward with Dr. D, our monthly show, the first Wednesday of each month at 7 p.m. We also have Talks with Dr. D, breast cancer, which is how I started for my breast cancer journey, interviews with doctors, different speaking engagements from the Divine Nine organizations to the United Nations. I've had the opportunity to speak. And lastly, Sisters on the Vineyard, my 501c3, which is occurring on Martha's Vineyard this Tuesday from 11 to 4 p.m. You can go on Talks with Dr. D and you can find all of the information I said. And these are always recorded and saved to my YouTube, which again, Talks with Dr. D, YouTube, LinkedIn, Instagram, and Facebook. And it's been an absolute pleasure to have you guys. We love that you guys tune in. Thank you for tuning in. Thank you for supporting us and to educate the community that podiatry exists and there are podiatrists who look like us and beyond. Any parting words, Dr. Trent, that you'd like to say?
I just want to say thank you for having me. It's been a pleasure. I look forward to listening to some more of your talks. Definitely the Martha's, the Vineyard one. So you said next Tuesday, right?
Next Tuesday is going to be, it's not going to be recorded for this.
Oh.
I will let you know how to get it. So now you guys have to really follow me.
Yes.
I'll let you know how to find some of that information.
Okay.
There will be a quick blurb on podiatry, but the focus is a whole bunch of other things in medicine. 8 board certified doctors, a wellness coach. We have Sunny Hostin from ABC's The View as our keynote, and Malik Yoba from Empire for the younger folks, and New York Undercover, who's going to be one of our guests as well. So if you're interested, or a lot of us who go to the Vineyard, if you want information, you can find us and Talks with Dr. D, and just type or push the button that says Sisters on the Vineyard, and all information will be there. And I thank you. And again, you have been tuned in with Stepping Forward with Dr. D, where we talk about all things podiatry. We always encourage you to grab your favorite beverage and sit back and relax with us to learn and be educated and also entertained. We're never boring. And we look forward to seeing you next month. And we'll be putting posts to let you know what our next fabulous topic is. Have a wonderful summer. And for those starting school in other parts of the country, welcome back. Thank you. Bye, everyone.